Did you fall and dislocate your shoulder? And I'm sure by now you've been to the doctor, but they probably didn't give you a ton of information other than put it in a sling and tell you to rest it and not move it. So now you're a couple weeks out and you're not really sure what to do about it. Well, then today's video is for you. If you dislocated your shoulder and it is currently dislocated, you should definitely go see a doctor and make sure it gets relocated, because a dislocated shoulder is not actually going to be able to heal itself. I'm assuming at this point that you've been to see the doctor, you've gotten it relocated. Again, they're going to tell you to be in a sling because they don't want it to move. And that usually lasts for a couple weeks. Kind of depends on multiple issues, including how old you are, how long it was dislocated, as to how long they'll have you stay in the sling. The problem comes when you get out of the sling. Now, I am not saying you should not follow the doctor's advice, okay? On this one, we have got to assume that your doctor knows best because they've seen you, they relocated that shoulder, they know how things feel. We need to get some stability in that shoulder. And it's going to take as long as the doctor said it was going to take. So I'm not going to give you a timeline and say, oh, it only takes a short period of time. It can take a longer period of time. And your doctor is going to be able to advise you on what to do. The challenge is that scar tissue is being built during that time. Now that's the whole point. That's why you're in the sling. That's why you're not supposed to move that arm, is so that scar tissue can be built up, because you dislocated your shoulder and it's sloppy and it's moving around all over the place. You need to use the sling. You need to allow the scar tissue to build. However, when you get out of the sling, what do you do? Because obviously we want to remodel that scar tissue so that it gets into more normal alignment and it doesn't cause problems in the long term. Often doctors at this point are just like, okay, you're healed because you healed from the dislocation, right? They relocated it and you were in a sling and now it's actually staying where it's supposed to. And the doctor's like, great, my job's done here, which is true. Their job is done and we are very grateful for them. However, now, once that has all scarred down and it's not willy-nilly all over the place, you need to see a physical therapist to actually get that shoulder moving correctly again. Now, the concern is that many doctors don't want you to see a physical therapist because, well, frankly, we have a bad rap. We have been to continuing education classes that say, oh, if your patient's shoulder isn't moving, then you just grab it and bring it up over their head. And if any of you PTs out there are watching this, you know exactly who I'm talking about with that. Anyway, we all went to that class. It was very popular for many, many years. Many, many years. Unfortunately, the doctors found out that we did this and they said, no, that's a shoulder that is moving too much. You don't need to be that aggressive with it. And I agree with you, doctors. We don't need to be that aggressive with it. But what has happened is that the doctors now won't refer to PT because they're afraid we're going to yank your arm around and sublux it again. So you're stuck with a shoulder that now doesn't move, that moved too much, now it doesn't move, and nobody to help you figure out how to move it correctly. And this is where I find many, many people get stuck because they don't move their shoulder because the doctor told them not to move it too much, which again, in the initial phases, I agree with that. However, once it's healed, we need to get it moving again because you can't walk around with your shoulder like this for the rest of your life, right? And you know what I'm talking about because whenever you try to lift your arm, you've lifted your shoulder up like that. Yeah. And that's very common because it's hard to keep things moving correctly when you don't have some help in how to do that. I know it seems silly because before it was dislocated, it moved just fine and you didn't have this problem, but now it's been dislocated and everything's been stretched out and then you were put in a sling and everything's tightened down. So what are you going to do about it now? You need to find a really good manually trained physical therapist who can help guide you through a very specific program to be able to get things moving correctly without moving them too aggressively. If you have someone who starts yanking your arm around on the first visit, friends, you have not found the right person. okay? If your shoulder has been dislocated or subluxed, you should not have anybody yanking around on your shoulder. Now, they may do some passive motion to help encourage motion through your shoulder, but it should never be painful. It may feel like a stretch. Stretching is okay, but it should never be painful, and you should never feel at risk of it dislocating again. If you do, you need to communicate with your therapist and say, hey, I am not feeling comfortable with this. Can we change this up somehow? Because you're not going to be able to relax. So what happens is if you feel like it's going to dislocate and you're not able to relax, all that happens. And then is that going to be any good to you at all? No, because it's encouraging this pattern that you've already started doing on your own, which is not the correct pattern in the first place. You need to find someone who's going to gently move you, who's going to help guide you on exercises that are safe, that are not too aggressive to start with, that move you and progress you into getting more motion, and then in the end, restoring strength. I also don't agree with starting with strengthening exercises right away, because why do we want to strengthen your shoulder here? This does you no good. Is this how you want to be for the rest of your life? No. All right. So we need to get full motion, coordination we call that. Then we need to get endurance. So we need to get everything moving for functional daily activities. Then we need to work on strength. So you can pick up your kids or unload the groceries from the car or do all of those fun things that we want to do on a regular basis. But you need to find someone who can help guide you through that, who you feel safe with and comfortable with, who you can communicate with so that you can get the best results. I hope this has been helpful. If you have suffered with a subluxed or dislocated shoulder and you're currently in a sling, stay in the sling for as long as your doctor told you to. It's important to allow that scar tissue to form initially, because we do want to allow that because it's going to provide stability. However, you are going to need physical therapy in order to help get that shoulder also moving correctly. So stability is what we want in the beginning, but in the end, we want correct movement. So find someone who you feel is an advocate for you, who can communicate well with you, who listens to what you have to say to help you start working on your coordination, your endurance, and your strength. Now, if you feel like you have a frozen shoulder, I definitely recommend you check out this video, and I'd love for you to click subscribe. Have a great day. Bye.